Hello and welcome to Parkinson's Resources webinar series. Thank you everyone for joining us today. Although it's a bit cloudy here, I am not upset about it because we have such an amazing and exciting speaker today and topic. So I'm Melissa Greer. I am the Program Manager for Parkinson's Resources of Oregon. For those of you that may not know Parkinson's Resources, we are a nonprofit based in Portland with employees in Eugene and in Bend. We provide support and educational services to people whose lives have been touched by Parkinson's disease. And we host these online presentations in an effort to make information on a variety of topics available through live interactive video webinars that are free for anyone to access. However, this is our new norm, so let's get to it. I hope everyone is safe and happy at home and doing well. As many of you know, here at Parkinson's Resources, we have been working to kind of reinvent programs and need for programs at the time during this time. I am proud to share that we have had over 34 successful virtual support groups and counting, and we continue to provide online education and services, wellness programs. And so if you have any questions about any of those, feel free to email me at melissa@parkinsonsresources. Also, if you're having a challenging time coping during this time, or if you know someone that is, these are not easy times right now. So I encourage you to reach out to any of our staff or call our helpline. So before I introduce our speaker, just a few tech things that I want to go over. Some of you already submitted questions. Those are great, perfect, we have those. But if you do have questions during the presentation, please feel free to write those in our question box. We also have a chat box, so if you're having any technical difficulties, go ahead and chat there, and we will do our best to get assistance for you. And we are going to try to get to as many questions as possible. So please be patient with us. And I'm going to introduce our speaker, because that is what everyone is here for. So Dr. Kelly Rees is a certified sexologist with a private practice here in Portland, but she sees clients throughout the state and beyond. So I'm going to hand it over to Dr. Rees, and thank you so much for being with us today. And I will hand it over.
Thank you. Thank you, Melissa. Hi, everyone. So, wow, this is a different format, isn't it? I'm looking at my computer instead of at you. I'll trust that you're listening. So today I'm going to be talking about intimacy and Parkinson's. You know, sex is part of intimacy, but not the same thing as intimacy. And sometimes we conflate those two, that when we say intimacy, we mean sex, and that's really not the case. So I want to shift our thinking a little bit and expand it both to what is intimacy, and also what is sex. We get to look at expanded definitions of both of those things. And there's a great payoff for doing that, and that is more satisfaction and more connection. So, excuse me. When we're thinking about sex, a lot of you had questions about physical connection with your partner, and one of you has Parkinson's, and they have some very specific challenges that I'll address in a minute. Physical challenges, emotional challenges, and then some solutions or some ways to address the issues that you have. So the first section is for physical challenges for Parkinson's, and you're probably all very familiar with that, you know, excuse me, from masking so you can't tell facial expressions, to stiffening body, loss of control, shaking, pain, very specifically for sexual issues, erection and lubrication issues, physical awkwardness, and having medications impact your sexual functioning one way or another, and exhaustion. Some of the emotional and mental issues you might be dealing with are embarrassment and awkwardness, changing interest in sex, either your sex drive is dampened or it's increased, depression for either person, and compassion fatigue. You may have a low or absent libido. These are all really legitimate concerns, and it's great that you're here to find out more information, to make your lives richer, and to have your connection be better. Excuse me. So, your best tool for better intimacy and a stronger relationship is communication. Communication. You already knew that, but I'm going to tell you again. There are a few different areas that we can look at for communication, and a lot of the work that I do with people is just about that, learning how to communicate better. And so for us today, we're going to talk about communicating with each other and then communicating with our healthcare providers. So communicating with each other, we can break down into before an intimate encounter, during an intimate encounter, after an intimate encounter, and then ongoing communication. So before an intimate encounter, what kind of things do you need to talk about with each other? Of course, I have a frog in my throat today. We want to talk about scheduling, planning, and setting expectations. So you can, the point of all this communication is to make your experience as good as it can possibly be by looking to the details that you can control and working with the things that you can't control. And when you can communicate openly and honestly with your partner, when you can really express yourself fully, when you can allow your partner to understand the things that are important to you, things that you desire, things that you miss, how you feel about everything, you have a better shot at actually being seen and met. You have a better shot at keeping your connection strong and alive. Even if you don't always agree on what you want, at least you're seen and heard. So before you have an intimate connection, before you have an intimate appointment, sexy time date, however you want to call this, you want to make sure that you've scheduled it so that you're most likely to be successful. And for for many people, this means possibly having a time in the morning when you're not tired. Exhaustion is a huge issue with Parkinson's and with caregiving. And so you want to make it a time of day that you set aside for intimate connection when you're most likely to succeed. You want to take into consideration when your medications have the biggest impact on you so that your symptoms are the slowest and you have more flexibility and more interest. You also want to set your expectations. So, and you do that by speaking to each other about it. I'm hoping we can have this amount of time together today. I'm hoping we can have physical closeness. I'm hoping we can share affection, those types of expectations. During sexy time, I'll just shorthand it to sexy time, even if it doesn't have sex in it, even if it's not sexy. During the sexy time, you want to share. Will someone give this girl a cough drop? Good grief. Excuse me. During sexy time, you want to share words of appreciation. One moment, please. Oh, they're so big, I can hardly. So,
It's all part of the new normal with virtual.
This happens to me often. I work via Skype all the time now, and just speaking like that, I end up needing, that's why I have cough drops on my desk. So you want to share words of appreciation, asking for what you want. And words of appreciation might look like, I love it when you touch me like that. Thank you so much. That was really fun. This is great. I'm enjoying this. Asking for what you want might look like, could you please touch me in this way? Could you please move your arm? Could you please move this cushion? It's important that during your sexy time, you do what makes you feel sexy, what makes you feel good. If we can change our focus, this goes for everyone, not just for people with Parkinson's, but all of us. We all live in bodies, and the bodies all age. If you can shift your focus away from performance and achievement to pleasure and connection, so that you're doing and you're asking for things that make you feel good, that make your partner feel good. And during your sexy time, that's what you're choosing. Doing things that make you feel sexy, that make you feel alive. Offering things that make your partner feel sexy and alive and good. People often ask me, what's the best sexual technique? And the answer is very simple. It is presence. And by that, I mean being right here, right now, in this body, and being open to this person who's with you right here, right now, in their body. Everything else comes away from that. And after sexy time is over, it's nice to talk about it and kind of, share what worked, share what didn't work. You can call that your gratitude and your challenges. I really liked it when you touched my foot this way. It felt great when you used your fingernails a little bit. I really liked when you're touching my hair or kissing me. I would prefer you did this instead of this. Maybe the fingernails were not so great. So I would prefer that you not use your fingernails, you just use your fingers, the pads of your hands. I would prefer you not tickle me. I would prefer we change the time of day that we did this. What would you like me to do when something happens? What would you like me to do when you're feeling this way? Here are some things I would like to change. Here are some things I would like to add to our play. Here are some things that I would like to not do anymore. All these things fall into the category of conversations that we have after an interlude. So we have the before, the during, the after conversations. Once again, the before means scheduling, planning, setting your expectations. During is words of appreciation, asking for what you want. And afterwards is gratitude and challenges. And Melissa has a little card that has these things on it that she's going to share with you at the end today, because I thought you might want some notes too. Ongoing conversations about intimacy and sexuality have to do with sharing your likes and your dislikes. Now, this goes back to what I spoke about in the very beginning, how important good, honest communication is for intimacy. I often hear people say things like, if I told my partner what I wanted, they would feel bad because they can't give it to me. And so they withhold what they actually want. I'm an advocate of sharing openly and honestly. And it's a fact that we can't all fulfill each other's needs. If you can relax into that and realize that it's still all right for you to share the thing, it's not your partner's responsibility to do everything you want. It's not your responsibility to do everything your partner wants. That's not what we're here for. And sometimes you might find that you have gratitude, you have generosity so that you can share more than you thought. And if you don't know what your partner wants, how can you be generous and do the thing they want? So an ongoing conversation, what are your likes? What are your dislikes? What things turn you on? What things turn you off? You might want to talk about which of your 5 senses is your most sensual sense. You know, as your body is shifting and changing, your sense of smell might become much more tuned in. Your sense of hearing, your sense of touch might change. So have a little conversation about when do you feel like, which sense do you have to feel the most sensual or the most sexy? Do you get turned on through one sense more than the others? Many of us, especially men, are very visual creatures. And sometimes that changes, you know, as all these other things are happening in your body too. And over time, that might change. So discussing it is really helpful. A really great question to ask each other and to ask yourself is, what am I afraid to tell you? Now, we're talking about sensual and intimate connection here. So almost everyone has something they're afraid to tell their partner. They're afraid to tell because they're afraid that their partner is going to feel hurt or be upset or leave them. And sometimes that's the fear, that you're going to leave me. It's still important to take that question and feel into it and say it. I'm afraid to tell you. I'm afraid to tell you you're going to lose your attraction to me. I'm afraid to tell you that I've lost my attraction to you. I love you, but I'm not attracted to you anymore. Some of these things, it's easier to practice by yourself first, and then you can share it with your partner. Some other things you might want to talk about in an ongoing way are, what do you like to experience during a sexual or sensual encounter? Maybe tenderness and softness and closeness. Maybe intensity or aggression. Maybe you want to transcend in your connection. Some people do that. They transcend through the intimate sharing. Maybe you want to feel your rebelliousness, or just for release, or surrender, or dominance, or submission, abandon, unboundedness. All these things are connected to sensual and intimate encounter. They're connected to sex. Feelings of freedom, freedom from responsibility, the ability to feel ruthless for a little while, timelessness, to be able to give, to be able to receive, the feeling of being taken, the feeling of taking, of possessing. All these things are very valid experiences that people look to sexual and sensual encounters for. And it's wonderful if you can investigate that. Be curious. Ask yourself, what am I wanting? Ask your partner. Even though you have physical limitations, even though you have all these other things to manage, this can offer you some freedom and deeper connection. So Speaking of physical things, there are a lot of different things you can do to assist your physical intimacy. And this is for everyone. This is for all aging people, and sometimes people who are not aging, who have some limitation in their physical bodies, and they need to help themselves. So as I talked about before, scheduling and planning. For a lot of people, mornings are better for a sensual encounter because they're more refreshed. Their medication, they can time it so that medication is maximally effective and minimally invasive. Ask yourself together, how can we make this as great as possible physically? Timing, medications, getting the room ready, having your room prepared so that you don't have to go wandering around the house looking for an extra cushion or pillow. You might need to use props, firm pillows. There's several lines of I think they're called marital aids still, that are cushions that are in different shapes, like triangular shaped cushions, and they're firm. And you might want to also experiment with softer cushions too, so that your bodies are comfortable and supported. You might want to experiment if you're having sexual encounter with different positions so that it takes the stress off body parts that are straining, off knees, off hips, off elbows. If it's uncomfortable for you to lie flat, then you can prop yourself up. All kinds of things to do. And I work with people closely to help them figure out how to let their physical bodies connect with each other in pleasurable ways that don't cause more strain and stress. If you've never used a sex toy, keep listening. So very often sex toys are vibrating. They vibrate because the vibrating part, when applied to a sensitive area, provides more stimulation than you can get with just bodies, with just hands. And sometimes that makes the difference between not having an orgasm and having an orgasm. So if you're thinking right now, oh God, no, I don't want to have to resort to that, keep listening. It's often the case that not just people with Parkinson's, but all people, as they age, their relationship to orgasm changes. You know, maybe it was never great to start with, and it often, orgasm gets more elusive as people age. So if you knew how many people use sex toys, use vibrators to give themselves that experience of orgasm and release, you wouldn't feel funny about it at all. And you can shop, of course, from the privacy and comfort of your own home. The other thing you want to think about is lubrication. You know, as often as men have a difficult time getting and keeping an erection, not just with Parkinson's, but yes, also with Parkinson's, women also have a difficult time lubricating. And there are a number of reasons for both of those things. The bottom line is, it doesn't have to be uncomfortable, and lubrication is your friend. There's a great shop in Portland called She Bop the Shop, and they have a big line of, they have a line of every kind of toy that you can imagine, and lots and lots and lots of different kinds of lubrication that they also sell in little sample sizes. So it's not a big investment. All of their products are safe for bodies, which is not the case in general. You want to find something that is not manufactured with toxic materials, and you don't want petrochemicals in your lubrication. So you can look at those later if you want. Make sure something is easy for you to use and works well with your body and you don't have a reaction to it. So yeah, all these things you want to have gathered in your room. This is room readiness we're talking about, that it's clean, that it's neat, you have cushions there to assist you, maybe a glass of water, toys, lubrication, so everything's ready. It's very important to let yourself shift from one state of being, from caregiver and Parkinson's person, into lover mode. And that might take some time. So allow yourself the transition from one state to the next. If you're the caregiver, let yourself step out of the caregiver role. Take the break from the caregiver role and shift into lover. If you're the person with Parkinson's, let yourself shift out of that of needing to be cared for and into lover. There are so many things that you can do. There are so many ways that you can touch, that you can connect. Let yourself remember that and open into that role. While you're being physically intimate with each other, it's very tempting to think your way through it, but thinking won't get you there. I mean, it's nice to have a mind too, and minds can be very sexy, but let yourself focus on your bodily sensations. Let yourself focus on physical pleasure. It can be challenging. There's so many things to think about and to worry about and to wonder about. So it's kind of a practice then to let your mind rest about these things and just sit back into your body. Why don't you try that right now while you're listening to me? Sit back into your own body right now. Put your feet on the floor if they can reach the floor. Feel the seat underneath your thighs. If there's a chair back behind you, sit back and feel the back of your chair. See if you can feel your breath moving in your body. See if you can feel your hand touching your other hand. What does that feel like? My hand is kind of cool right now. It's actually, my palm is a little sweaty right now too because I'm excited. How firm is it? All these things you can be really curious about when you're being intimate with yourself, with your partner. Let yourself be very curious about that. Hands on your face. Oh, my face is warm and soft and smooth, and my cheeks are a little squishy. So tuning into your physical body when you're having intimacy, very important, because that's where your pleasure is, in your body. Another thing that you can do to help yourself is watch your sleep hygiene as much as you can. I know sleep can be a very big problem, but if it's time for sexy time and you're exhausted, it's all right to reschedule it. You want to set yourself up for success. And if you're exhausted and you know it, then it's going to be difficult for you to relax and connect with your partner. Then reschedule. Okay, so now on to emotional and mental things that we can do. I've said it before, I'll say it again. Focus on pleasure instead of performance. Most of us, when we were young, had this idea that sex was about performance. In fact, people email me daily about their sexual performance. That's not a very helpful use of language. If you can consider how you're finding pleasure, how you're experiencing pleasure, how you're giving pleasure, rather than, do I have an erection? Is he getting an erection? Is she lubricating? Am I doing it right? Am I doing it wrong? Do we have enough time? Do we not have enough time? Yeah, so we set all the things up to allow the most success possible and shift the focus back into pleasure. Does this feel good? You might be surprised at what feels good. Most people are. Watch your expectations. See if you can allow yourself to set expectations that are realistic. That would be physical expectations, you know, will our bodies do this in this way? Can we do this without getting hurt or without causing cramping and pain? And maybe we need to shift what we're doing so that we don't have cramping and pain. Watching your mental expectations. What does it mean if I can't do this? What am I going to get if we manage to have good intimacy? And your emotional expectations. Oh my goodness, if we could only just let the past be in the past, and the future be in the future, and let us be right here, right now. Many people are haunted by their past ability, by their past connection, by their past sexual experiences. I say haunted because that was then, and this is now, and here we are. You know, you could mourn what's lost in your physical connection, or you can be grateful for the things that you do have. And it might be difficult to focus on the gratitude part when you're really feeling that, oh, I used to be able to do this. But this is a practice. And so you get to practice letting that go and being here now. Yes. And then allowing enough time, emotionally and mentally, allowing enough time to make that transition out of your daily roles into your sexy time roles. Really, that's a physical thing and it's an emotional and mental thing too. That transition is very important. It's also really important. This is a valid part of every person's life. How they are in this is a valid part of your life. And if you need more emotional support for your sexual life, you can ask your doctor, your medical team. You can ask your therapist if you have one. You can find a sex therapist like me. You can find an impartial friend who can give you support if you ask for it, if you talk about it. These things, it's very important. That's why we're talking about it here today. That's why I talk about it all the time, because I recognize, you know, so much of us, our concept of ourselves has to do with how we are in our sexual lives. Not for everyone, but for many, many people, our concept of ourselves, our feeling of being okay in our bodies, our feeling of being okay in our relationships. If that's not working, that can really hurt. And so it's very much worth it. And it's very much a valid way to spend your time and attention to look for help. So we've been talking about communicating with our partner before, during, and after. We've been talking about physical and mental and emotional ways to shift ourselves around to have a better experience. And now I want to talk about communicating with your healthcare team. For some people, it's very difficult to ask about making their sex life better, you know, because somehow that's seen as private or embarrassing or shameful to admit that we have a sex life or to speak to a doctor about it. And frankly, some doctors are not great at answering questions about that. Don't give up. It's important for you, then you deserve it. So if you're talking to your healthcare team, you might start by asking a very general question or saying a very general thing like, things have changed for me sexually, or us, things have changed for us sexually. Can we please talk about that? And that will set the tone for your care team. And, you know, if they're not comfortable talking about that themselves, ask them to refer you to someone who is. You might want to ask, are there sexual side effects of your medication? Because very often there are. Sometimes you can find different medications that don't give you the side effects. You know, and some of the side effects can be difficulty in getting an erection, maintaining an erection, difficulty in orgasming, difficulty in lubrication, complete lack of sex drive, like you might find that your sex drive has fallen off to nothing, or hypersexuality. If you find yourself much more interested in sex now than you used to be, you may want to check that with your doctor. And your doctor might not remember or know to ask you about it beforehand or in an ongoing way. You might say to your doctor, I want to talk about my intimacy issues. If it's too challenging to bring up sex, then you can go through the intimacy route. And intimacy might look like all kinds of different things, like touch, like eye gazing, like intimate conversation, all these different things. So if you bring it up to your healthcare provider as intimacy issues, it might be easier. You might say straight up, my sexual functioning is affected by my medication, and you want to know if there's any alternative to that. I want to look into medication that doesn't impact sexual functioning. What can we do? You might say, I'm much more interested in sex now than I was in the past. Could you check it? Yeah, so, and that's also, Melissa has that on the conversation card at the end too. You can take that with you. Maybe you can make a screenshot and keep it with you. Okay, now I'd like to answer your questions. I'm so glad that you asked questions. You know, this is great about this format because it's easier for you to ask really important questions that might be very personal. I presented at the Parkinson'S fair last year. I think one person out of the whole room asked a question, and I understand why. So, you know, if you're a person who has the question is, I can no longer perform sexually, and I'm too embarrassed and ashamed to talk about it. I understand. Yeah. So the first thing that you want to do, well, there's two things. You want to speak with your doctor about it, and you want to speak with your partner about it. Now, I've seen this happen over and over where someone has difficulty getting an erection, and instead of saying to their partner, this is happening to me now, it's weird, I don't think it has to do with you, I'm just having a hard time getting a hard on. Instead of saying something like that, they pull away from intimate contact. They avoid intimate contact because they don't want to feel embarrassed or ashamed by having their functioning having their body not behave the way they want it to. So know that your partner can be your ally, even in your sex life. And if that's too difficult, then you can ask your doctor about it. It's really important. I mean, it's so important for most people's sense of themselves has to do with this. That's how important it is. So please ask your doctor. I can no longer perform sexually. I'm too embarrassed and ashamed to talk about it. Tell that to your doctor. And there are a lot of different things that you can do with that. If you're eligible for Viagra and Cialis, sometimes that can really help. Viagra and Cialis don't make it easier to orgasm, but they do make it easier to maintain an erection. And I wish there was something to do for women, some medication that we could give for women that allows them to lubricate more, but so far, no. There is a pink Viagra. It completely doesn't work. Don't bother. But that's one more reason to use lubrication. Okay, the next one is, it's been so long since we've connected intimately. My body has changed so much. I don't know where to begin. Yeah. So where to begin might be having that conversation that, you know, saying to your partner, I think I'm still interested in this. I don't know how to do this. Can we figure this out? Can we talk about it together? And the next question is age and PD. How do these two items affect normal non-PD people? Pretty much everything we've been talking about affects non-PD people. I don't know if non-PD people are normal, but everyone who lives in a body has to deal with changes in their body. You know, if it isn't Parkinson's, it's losing flexibility, it's illness, it's being uncomfortable in certain positions, it's feeling shy and self-conscious about things not working the way they used to, or not being interested in things the way you used to be interested. So once again, all these things, and good communication goes a long way to normalize what's happening and to solve problems that are solvable. Also, every woman goes through menopause, and a lot of women, when they go through in perimenopause and menopause, can have a very different relationship with sex and with intimacy. Some women lose interest altogether for a period of time. It might be a long period of time. It might be forever. For some women, while they're going through the changes, they lose their interest, but then it comes back. And for some women, going through menopause means they're much more interested in sex than they ever were. The male version of menopause is called andropause, and not many people actually know that. Unlike menopause, not all men go through andropause. It's marked by a decline in all drives. If you are a very ambitious person in your youth and you find that you're kind of happy sitting on the couch now, or you're much more interested in your grandchildren than in taking over a company, you're much more interested in how your partner's feeling and how they're doing than you used to be. You may be going through andropause, and you know that there are great things about that. And one of the things about that is a decline in testosterone, and you might see a decline in your sex drive. And that's also fine. The next question. What are some ways we can live in peace and joy with our differing intimacy needs? This has to be the most common question that couples bring to me in my practice. They have different intimacy needs and interests, and they're looking for a way to have a happy relationship. So in the very beginning, I talked about changing our definition of intimacy, broadening our definition of sex. If you look at the human need for connection and for touch, and allow that connection and touch don't necessarily have to be sexual. If you're able to be in your intimacy with each other and connect on that level as heart opening and touch centered. Oh, I forgot the question I'm answering. Yes, differing intimacy needs. It's still a good thing to express what your needs are, even if you think your partner is not going to give that to you. It's still a good thing to express those needs, not as a way to make yourself more frustrated or to make them feel bad, but simply to show up, simply to be there. And you can refine and redefine your intimacy to fit your life and your relationship, you know, as your abilities change, your intimacy changes. You know, if you had a dynamic sex life in your youth, and now that's gone, but you still live in a body. Your body still wants touch. Your body still wants connection. Your heart and your mind want connection. So finding different ways to find each other, that might be a very fulfilling thing. Next question. One of the most difficult things for me is desirability. The tremors and other PD symptoms are difficult to detach from. It always feels like there's a third entity in our intimate relationship. Would love to have you address this, since I'm sure it's a fairly universal feeling and so difficult to discuss with my spouse without crushing him. Yeah. You know, I don't know if it's the person with PD or the caregiver who asked that question. It could be either. We have so much self-consciousness, many of us, just living in a body. You know, it's in Western culture, it's very challenging to actually feel happy and good in your body, even with nothing going wrong. And so, yeah, once again, I would say, the more you can communicate how you're feeling, the better the better your outcome is going to be. And the more that you communicate it, the less shame and embarrassment that you'll feel about it. If the tremors are off-putting, hang on. Yeah, the tremors are off-putting, then it's possible that you can find a different positioning so that the tremors might not be so severe and it might not be distracting for you. And if you can manage the time of day and the medications so that the symptoms are less severe, that might help. Yeah, but I would start with communication, really communication. How much you can show up in your relationship. The next question. I'm curious whether a lack of focus on connection is a common issue for people with PD. Seems like the lack of dopamine might be impacting how much pleasure folks take in anticipating connection. And of course, pain, physical discomfort is a distraction. But I wonder if there are other neurotransmitter-based reasons that folks with PD might have fewer impulses to be connected. There I go again. Cough, cough, excuse me. So I don't know the specifics about the neurotransmitter connection and the neurotransmitter-based reasons for connection or not connection, but I do know that if your expectation is this next hour is going to be difficult and I'm going to feel weird and uncomfortable and my partner probably doesn't like me, you're not going to want to connect. So to bring yourself into that and to set yourself up for connection, talk to your partner about it, about your connection desires. You know, if your partner's having difficulty having affect in their face, you might not look to their face for connection. You might find it in different ways. If that's changed over time and you remember the person that they used to be and you want that person to be there, that's not going to happen. The person that you're with now is there. And so find different ways to connect and communicate. And it might not be through facial expression. It might be through physical touch. It might be a meaningful touch. You could ask for specific things, like asking your partner, when you want to connect with me, put your hand on my shoulder or on my side, something like that. So I know that's what you want. And then go from there. Build your own way of connecting. Yeah. The next question is, what advice do you have for a person with Parkinson's that has zero libido? You know, it's not your job to be sexual. It's not your job to surrender yourself to your partner. You don't have to do that. If you have zero libido, honestly, really no libido at all, that's fine. Don't make yourself do things that you don't want to do. Please. Stay here and now in the present. And if there's some other thing that seems pleasurable to you, you know, maybe the thought of sex and intimacy sounds not interesting or boring, or there's nothing in it for you. What about just touching each other's legs? What about just stroking each other's arms or back, or some way that you can connect in that doesn't feel pressuring, that doesn't feel loaded? Pretty much everyone still has some room for pleasure in their lives. In the beginning, I was talking about, you know, which of your 5 senses do you feel more sensual in? And you might not think of it like that, but you might have one sense that's more alive than others, and that would be the place for you to play together. If you know no interest in sex and sex is not happening and you still want connection, you still want touch, you still want sweet words, you know, you still want to listen to music together and speak to each other. You still want to smell wonderful things. You still want to share delicious tastes. Those are things you can do that don't require libido at all. Okay, next question. Oh, this is very big. I have compassion fatigue, no interest in sex. My husband has a flat affect, so there are no nonverbal cues or flirting. I bathe him, dress him, wash his feet, feed him, cook, pay bills, and drive him. There's no foreplay, unless it's self-foreplay, and I don't have the energy for that. Any tools we can use to correct our course? I love him so much and actually make love to him all day long by the caregiving I perform. I'm exhausted at the end of the day and fall asleep almost immediately. Wow. Yeah. So I want to remind you that it's not your job to be sexual. It could be your delight, but if you're exhausted, it won't be delightful. So I would say the first step is to care for yourself, find more support and care for yourself so that you can give your compassion fatigue a rest, that you can give your body a rest. It's beautiful the way you say you're making love with him all day long by caring for him. That's beautiful. Maybe that's enough. If you say that you're so tired that you don't have time for self or energy for self foreplay, you don't need to. The only reason that you would do that you would touch yourself sexually, is if you wanted to. And if you don't want to, you don't have to. Once you get your basic exhaustion taken care of so that you have some level of interest in sensual or erotic connection, let yourself have that shift from caregiver to lover. Figure out ways, and maybe other people can help you, figure out how to shift from caregiver into lover so that if you want to, when you want to, you can open to your partner as a lover. You can meet them as a lover. And that would be nourishing for you. All these things, sexual connection, excuse me. Sensual and sexual and erotic connection have the ability to nurture and fill up our tank and offer ourselves love and delight. And they need to be not requirements, you know, they need to be from your generosity and from goodness and not from demand. The next question. My husband suffers from muscle pain and cramping associated with Parkinson's. As the disease has progressed, every time we have sex, his hamstrings cramp to the point where we have to stop. It's gotten to the point where we don't even try anymore. We're not sure what to do. So, you're still having sex. That's amazing. You're cramping every single time. That's not good. So initially, I would say that maybe it's time to look for a different position. Some other kinds of support. I don't know if drinking water beforehand or during, or taking a break would help. And again, ask your doctor. Tell them that you're cramping during sex, and sex is important. And so you wonder if there's some other way to manage things so that that doesn't happen so much. Next question. Is sexual dysfunction in a man with Parkinson's a given? And how does sexual dysfunction manifest in a woman with Parkinson's? So it's not a given. It's common, but it's not a given. Sexual dysfunction in men, as we said before, it looks like erectile dysfunction, difficulty in getting or maintaining erection, difficulty in orgasm. We can treat erectile dysfunction in terms of helping getting or maintaining an erection. It's difficult to treat the orgasm part. Now, there are some things that we can do that aren't general prescriptions that can help a person orgasm, and one of them is by using a vibrating sex toy. And that doesn't always help. Sexual dysfunction in a woman looks like difficulty in lubrication, low interest in sex, and difficulty orgasming also. And again, a vibrating toy can go a long way, and using lubricant can go a long way to help that too. Okay, we have a couple more questions and 2 minutes left. I've answered most of these questions already in the course of my lecture. Let's see. But this one I have not. My husband and I have not had sexual relations for 19 years. I continue to feel horny, which is uncomfortable. Will it eventually stop? And I feel like I get muscle cramps in my vagina and rectum. I'm not sure if you're the person with PD or if you're the caregiver. Horny feels uncomfortable. It's possible that you can find different ways to relieve that sexual tension on your own, if not with your partner. And cramping in your vagina and rectum could be Parkinson's, and it could be vaginismus, which is just that, an involuntary cramping and spasming in the muscles of the vagina and rectum. It's very painful. I would ask your doctor about it also. Your doctor might have some suggestions for you. And if they don't, then send me another message. There are a few things that you can do. Yes, there are a few things that you can do to work with your body to try to ease vaginismus. And there's a really good vulvar pain clinic at OHSU that might be interesting for you too. I have a last question here. Can you briefly address hypersexuality? It might be due to PD medication. Yes, and very few people, PD medication does induce hypersexuality. So what you can do in the moment, if it seems like it's out of control and too much, speak with your partner. Speak with your partner and see if you can redirect their attention and their behavior. Immediately speak with your doctor and see if there's some way that you can adjust your medication or change it if that's really troubling for you. So we're at 3 o'clock now, and with the end of our time together, I'm hoping that that was helpful and informative. Yes. And you can email me if you have any more questions.
Yeah, so I think this is a really important conversation and a difficult topic, but so I very much appreciate you sharing your knowledge and taking questions, and appreciate everyone out there for being open and honest. And this is why we chose this platform, so people could be really open and honest. For everyone out there, what I can do is I can send those the Parkinson's conversation piece that you have. I can email that to everybody today. And then also, if you'd like to connect with Dr. Reese, I can include that email, her link to her services if you'd like to look into that more. So thank you so much for taking questions and taking the time to connect with our audience. And thank you everyone for joining us today.
Yeah, thank you. Thank you for asking me. I'm very pleased to be able to speak about this because it's important. And so you know that I can give you a 20-minute free phone consultation if you want to call. So there you go. Okay.
Perfect. Thanks for adding that to that's great.
Yep.
Thanks, Dr. Reese.
My pleasure. Thank you. Thanks, everyone.
Thank you. Have a great day, everybody.
Bye.
Bye.